And parents can visit vaccine.gov to find a nearby vaccine site for their children and to schedule an appointment. And joining me now to give us more information on this is Dr. Carlos Roberto Jaen, professor and chair of family and community medicine at the University of Texas Health, San Antonio. Good to see you, Dr. Jaen. This is exciting news. Children between the ages of 5 and 11 who will receive a third dose of what those ages 12 and older receive. I want you to explain a little bit more about how this works, make sure we have a clear understanding. As we mentioned, there's this concern about giving the dose based on age rather than weight.
So let's keep that clear. First of all, it's really about the effect of the vaccine in the immune system, and the lower dose is just what kids need. And also, in the context of the studies that were done, it's an opportunity to lower the potential side effects that we all experience that are minor, but nevertheless, it's a way to make it effective. And the studies that have been shown now that it is effective in terms of reducing the severity of the disease and reducing death, because the reality is that from the beginning of the pandemic, 94 kids, 5 to 11, have died from COVID. So it's serious. It's not quite as severe as adults, but we still need to protect our children.
Oh, absolutely. And in fact, in the Black community, there's concern about children who are born, of course, with sickle cell or sickle cell trait. And there are people who are wondering if there was any testing during the trial phases for the vaccine that takes that type of thing into account, or if this is just a general trial for all children. Are you aware of whether or not those type of factors were considered?
I do know that the majority of those kids who died were Black and brown and from Native American communities. I also know that in the trial, not necessarily sickle cell, but kids who were obese or who had asthma had as good an effect as those kids who didn't have any other comorbidities. So there's or no other condition. So there is no reason to be concerned that it would not be effective, particularly in a situation like a sickle cell where you have a propensity to get infections and the reaction of the infection is likely to be more severe. So yes, they all need to be vaccinated and protected.
So, Dr. Jaen, if you're taking your child to see your pediatrician, what should you be discussing or asking them to make sure that this is right for your child?
So if you're taking your child to see a pediatrician or your family doctor or your primary care clinician, who is going to be the most trusted person that you know, it's also the place where most of the other vaccines for your child have been given. I think you need to ask all the questions that are potentially in your mind. What is the safety of the condition? What can I expect? How can I treat if they have any symptoms? What can I do? How is this going to protect not only my child, but also my other relatives and others in my younger children who may not be vaccinated, but will also be protected by having adults around them who are vaccinated, but also the children being vaccinated. But I think that a primary care physician or clinician that you trust is the best place to get those answers to your questions.
Absolutely. Now, let's say you do take your child to get the shot and you notice that they seem off. Is there anything that you should be looking for if you're concerned about them having any side effects from getting the vaccine?
So I think it's important to have the conversation with your child before you get the vaccine. The chances are that they're going to be feeling off. They might have a headache. They might have a little bit of a low-grade fever. They may have chills. They are going to feel sickish, perhaps. And it's important to understand that that's how the immune system is responding to the vaccine. That's how the protection is being built. But those symptoms are significantly more simple or less serious than anything else that you can get from the infection. But I think anticipating or talking to your 5 to 11-year-old saying, hey, you might going to be off. You may not want to be participating in a sport tomorrow. Chill is an appropriate response. And then once if the symptoms develop, They are common medications that are often used in children, like ibuprofen or Tylenol, that with consulting with your clinician, you can also give to ameliorate those problems.
Good to know. Have that ibuprofen on standby. Dr. Jaen, thank you so much for joining us. We appreciate your advice and all you do. Take care.